So the next question is, who is more prone to develop cervical cancer? Individuals, firstly, who are infected with this virus known as the human papilloma virus are prone to develop cervical cancer. Since males do not have a cervix, they cannot get cervical cancer. However, important point to be noted is that sexually active men can be infected with HPV and strains of the virus they can transmit to the females, and more than 40 HPV types can infect the genital areas of men and women. Men may develop HPV associated cancer of the mouth, throat, penis or anus from a particular strain. The International Agency for Research on Cancer found that nearly 13 types of human papilloma virus can cause cervical cancer. At least 4 out of every 5 women by the age of 50 years would have been infected with human papilloma virus. This HPV is also very common in men but has no symptoms. In India, about 5% of women in the general population are estimated to harbor cervical human papilloma virus of the type 16 and 18, which infection at a given time, and 83.2% of invasive cervical cancer is attributed to the 2 strains of HPV, that is 16 or 18. So once the virus gets into the system, it causes cervical cancer. Now, what are the symptoms? The early stage has no symptoms. Unfortunately, that is the problem, that by the time the symptoms do develop, the disease has already progressed. Advanced cancer symptoms can include vaginal bleeding after intercourse, between periods or after menopause, watery, bloody vaginal discharge that may be heavy and may have a foul odor, pain during intercourse, unexplained persistent pelvic and or back pain. Now, any of these symptoms should be immediately reported to your doctor. If the symptoms appear, it is important to talk with your doctor about them, even if they appear to be very trivial. The earlier the precancerous cells or cancer in the cervix is found and treated, the better the chance that the cancer can be prevented to develop full-fledgedly, or if before it causes any harm, we can cure you. That is very important. Now, there are 2 main types of cervical cancers named after the type of the cancer cells which cause them. Squamous cell carcinoma, which makes up around 80 to 90% of all cervical cancers. Adenocarcinoma, which makes up around 10 to 20% of all cervical cancers. So the next question is, how is it diagnosed? Many tests have been used for diagnosing cervical cancer. So first and foremost is the symptoms that the patient presents with. The symptoms you may have, your age profile, that also makes a lot of difference, the type of cancer we suspect, and the general health of the patient. Also, the results of earlier medical tests, they also have a very significant role. So how do we diagnose? I'll just tell you